Lasers and Leaders with Loretta Tway. Here we will be talking all about laser and light while growing your curiosity in the business side of the aesthetic industry and the incredible humans in it.
My name's Loretta Tway, CEO, dermalesthetician and owner of Dermology found throughout South Africa.
I am proud to lead a multi-award-winning brand, train professionals worldwide, and represent South African excellence on global stages. I firmly believe that we keep on learning every day. So come join me, let's learn together and smash those biggest dreams one after the other.
Today we are back, and this is officially my third episode on Lasers and Leaders with Loretta Tway. So welcome. I am excited about this topic because this is a very personal topic that we are going to be talking about today. I know there are many other people in this world, and especially who's listening to this podcast at the moment, who's had their own personal journeys as well. So I'd really love to hear from you also and what you have done in this situation. So today I'm all going to be talking about scar management and also share a little bit of detail in my personal journey, which I have been going through since about November last year. And feel free to ask me any questions and let's make it nice and engaging. So first of all, when we look at scar management, we need to understand what we are dealing with. And there's actually quite a few different types of scarring that can be present in the areas that we are treating, or that can occur in different situations. So firstly, we can look at something just at your normal fine scarring that you can see after injury to the skin. Usually it's quite superficial. Think of that mozzie bite or a bush or a branch scratching your skin, cat scratch maybe if the cat wasn't that angry at you. Then you're usually left with a thin red stripe that can either go into a brown stripe after, which we call hyperpigmentation. Sometimes this can lead to hypopigmentation, which is loss of color in that area. But generally, it's not really much of a muchness. It's quite easy to handle and also to live with. Then you can also get, obviously, keloid scarring. Keloid scarring is when the scar tissue grows beyond the borders of the actual injury in the skin. And most of the time, for people who has a keloid scar, they are prone to getting keloid scars. And that can be as simple as an injury to the ear, like an ear piercing, or a scratch on the skin, which can develop this excess scar tissue. And there's very specific ways on how to treat it, and most importantly, how not to treat these scars. Then you get something a little bit less aggressive, which is called the hypertrophic scarring. And I've got hypertrophic scarring, by the way, but I'll tell you all about it in a second. Hypertrophic scarring is also raised tissue, so excess growth of that scar tissue, but it still remains within that boundaries of the injury, so it doesn't go beyond it. This can still be very painful and extremely itchy. Keloids can be also very itchy. I also find that scars in the beginning stages, if it's something like a hypertrophic or even a fresh scar, they're itchy. And itchy usually means they're healing. However, when you have a keloid scarring, the scar tissue that goes beyond the borders, they can continue to be itchy because usually they can be in an active stage and they can continue to grow. We also see something like atrophic scarring, and this is the loss of scar tissue. So now we're looking at indentations in the skin. And where we see it at Dermology in the most frequent case is with acne scarring. And then again, when we look at acne scarring, there's a wide variety of different atrophic scarring that we can look at as well. And then, of course, there's contracture scarrings, and this is usually with more intense traumatic injuries to the skin, such as burns, where the tissue healed, but it's now very tight tissue sitting on that wound, and it usually can also limit mobility, especially if it's over a joint area, and a very difficult area to treat, and it takes very long to create some sort of relief in that tension. I have a case actually where I'm currently treating someone who was in a very big accident. It was a bus accident, and a piece of glass went into her upper lip, cut the area very deep, and now scar tissue has formed on the upper lip, but it's hypertrophic, but it's still contracture as well. It's very tight and dense scar tissue. So when she smiles, it pulls her smile in a shape that's not in her normal smile. So what we are trying to do is to release that tension in the tissue, and I'm using my Sciton fractional laser in a deeper depth. So I'm going in a nice micron depth, but I'm doing it at a very low density as my patient is a higher phototype. So I need to be very careful to not create damage to the skin. I do want to create those deeper channels of empty ablative channels in the skin to try and loosen up that scar tissue, but I'm keeping my density very low, because when we talk laser, and especially fractionated laser, density equals intensity always. So the more dense you're going to go in an area, the more intense the treatment is going to be. It's not always about the depth, but rather the density. And then if we look at in clinic, the type of scarring that we mostly treat and what we see here is mostly your acne scarring. And like I said just now, acne scarring can present in various types and forms. And we look at it from where they just the tiny little marks, so post-inflammatory hyperpigmentation marks, where we have browns and reds on the skin, little dots, discoloration of the skin, all the way to the atrophic scarring, where you have all the indentations in the skin. And all of this will be dealt with in a specific way. And based on the combination of the variety of acne scarring that's present, there will be different modalities and ingredients that needs to be put together to target this specifically. There's no one size fits all, because all of that, all the trauma on the skin post an acne episode will present differently. So the hyperpigmentation and the redness on the skin, all the PIH marks will typically be dealt with a phototherapy. And in our case, BBL Hero and Heroic is exceptional in getting a much even skin tone when we're looking at these kind of PIH marks. When it's the indentations or the atrophic scarring, then we're definitely going to have to look more on the laser side of things. And depending on the intensity and the severity and the type of the atrophic scarring, we're going to be combining things like Moxie, a non-ablative fractionated laser, to profractional, an ablative fractionated laser, or Halo, which is a combination of the two in one laser delivery. Halo is the first and only device of its kind in Africa, and the only one is situated here at Dermology in Sciton. It's an exceptional device that we can use to create deep thermal injury, but in a safe and effective manner on all Fitzpatrick skin types. And I absolutely love this modality for all types of acne scarring. Now, let me tell you about my personal journey when it comes to scarring. Last year, November, I realized I have a hernia present just below my breastbone, and it's called an epigastric hernia. Now, to give you a little bit of context, I have 2 children. I had 2 C-sections, and my youngest is now 6 years old. So it's quite a few years. I did know that I have quite an extensive case of diastasis recti, and that is when our abdominal muscles separate and they don't come back to the full extent again, but there remains that gap where the abdominals are supposed to come back together again. Mine didn't. In some cases, I was actually able to put 3 fingers horizontally next to each other in the midline of my tummy, and it would fit in between my muscles. That's how broad my gap was. And I assume from all the gymming, and I was very into my bar classes every single day for about 2 years. And then I immediately or suddenly I've discovered this epigastric hernia. So eventually I went to go see a surgeon, and she looked at it and immediately diagnosed it as such, and then also actually pointed out I have an umbilical hernia, which is located inside my belly button. And naturally, we went ahead and scheduled surgery for the repair of these hernias. And while she was in there, she was also fixing my diastasis recti. Quite a lot of muscle work and repair work in the abdominal region. And after surgery, I was healing nicely, but then I realized that on the top area of my abdominal area where she was fixing the epigastric hernia, this wound didn't heal properly and there was some protrusion happening. So I went back to her with my follow-up appointment. She then also recommended a scar revision surgery. And so we went ahead and did that. And now I am healed up. My diastasis is much better on the top side of my abdomen. I do still have it on the lower side. The hernias are fixed. I don't have any problems with that. I don't have pain with that. However, I do have pain in the scar regions. I have a big scar coming down my abdominal area and also around my umbilical area, which I have no problem with. As I said to my surgeon, I'll happily treat it on my laser side of things. I do think I didn't realize the extent of it. And especially the biggest thing that I did not consider is the area where these scars are at. I was just telling you, I had 2 C-sections before. So I've had major abdominal surgery before, and my scar is next to nothing. I've barely done something. I've done BBL and Profrac on it before, but it's never been a significant bother for me where I felt like it was sore or painful or itchy. However, now, even today still, we are about 4 or 5 months post-surgery. It is itchy. It's painful. Pilates is painful. Back bends in my Pilates sessions is not fun. So I really need to sort of get that area first properly stretched. I can't just go into a back bend. Now that the thing is, it's not the normal approach that I would have done for my C-section scars, where I would have gone straight after it was healed, about 6 to 8 weeks post, where it was healed from the outside. I would go in with my BBL, Euro, and Profractional and just get it done and dusted, and it healed super quick and easy. We also need to consider that I'm a little bit older than when I was treating my C-section scars. And our bodies and inflammation and all of that's in different levels in different stages of our life. So what I have been doing is, first up is your silicone strips. I cannot tell you how it has helped my scar to go from hypertrophic to flat within maybe 2 weeks. My scars was becoming hypertrophic, so thick red lines, thick scar tissue, so still within the boundary of the scar, but it became raised and blood red and sore and itchy. So I realized, the normal approach of just lasering a little bit of here and a little bit of creams is not going to cut it. What I did was I incorporated the silicone strips, and I'm using that for up to 24 hours a day. Then I wash the area. I reapply. In adjunction to this, or leading up to the strips, I was using Is Clinical's cleansing complex, shield, super serum diligently every single morning, every single night, just to help also with that first stage of healing of the actual tissue, which worked beautifully. And now that I'm using the silicone strips every single day, I have started my BBL Euro and Euroic sessions on these areas. Firstly, to work on the color, and the color is already looking much better. So when I say color, it's mostly red at the moment, so the red will start to fade, and eventually it will probably turn into a hypopigmented scar, so it will lose that color, which I have no problem with. But there is still some contractual scarring actually visible. And when I say contractual scarring, remember when I said It's a type of scarring where we see it after burn wounds, especially over a joint area where it limits movement. Just the skin is so tight, which makes movement difficult. And I think in my case, because it's literally in the middle of my abdomen and it runs over a large area of my abdomen down the midline, every time I move left to right or when I bend backwards, there's an immediate pull in that tight scar tissue. And that's why I have that contractural effects of the scar tissue. So what I want to do, in addition to lightening the presence of the color, the redness, is I want to soften that scar tissue, that contractural scar tissue. Remember my patient I was telling you about with the upper lip, who's had the trauma to the upper lip, and now when she smiles, or when she first started to me, it made her smile look different than what she's used to. We did some profractional and it really softened that tight scar tissue, and now she's able to smile her normal smile again, the one that she's used to. And this is exactly the same approach I'm going to follow on this tissue or the scar tissue on my tummy. So I'm starting off with my BBL Uroheroic plus clear silk, the ND-YAG, to further reduce that inflammation in the area, but then also adding profractional so that we can go in. Remember, I'm not going to go in dense. I'm going to go in at a very low density, so fewer holes in a square centimeter, but nice and deep so that we get through all that scar tissue to try and loosen all of that up. Downtime from this is there might be a little bit of pinpoint bleeding in the area, and about a week or so there will probably be some tiny little scabs, and it's just to show where each of those channels were made as we sent that laser through the skin. And I'll probably be doing this for the rest of the year, and I'm aiming to do these sessions every 4 to 8 weeks depending on my availability and where I am and what I'm doing. It won't really limit my daily life as it's on my tummy and it's covered by a shirt, unless if it's in December and I want to be on the beach. But that honestly will also not stop me, because at the moment this is a priority for me to fix it. One other thing I did not mention is massaging of the scar tissue. So I am applying my ingredients, I'm doing my silicone strips, I'm doing my treatments, my variety of treatments, but the most important thing every single day is massaging of that scar tissue. So this is literally while you're lying in bed, that last 5 to 10 minutes before you go to sleep. It's just to gently massaging that scar tissue. And this looks literally just by adding 2 fingers and going down the scar and just gently working your way down. So there's specific ways in doing it. I definitely recommend if you do have a scar and you want to feel more of a release in that pressure and the hypertrophic or the overgrowth of the tissue, this is absolutely something you have to incorporate on a daily basis, only a few minutes a day, and it will definitely contribute to a quicker healing in the actual scar tissue and also the appearance of it. So at Dermology, if you do have scarring and you are interested in having it treated, it's again, like I just told you, there's a wide variety of different scarring that we need to consider and appreciate. So your first step is to find your closest dermology and book your consultation with a specialist. We can either do this online, virtually, or you can come in on site and have your consultation done. And then your therapist will have a look at the area and recommend the best combination of ingredients and treatments and the downtime and how often you should have these treatments done, and sort of just give you a good plan of action, get that into place. And then you will know all your answers to your questions. It's important to understand nobody is the same. No plan will look the same. Each journey is different, and also it will change as you go. When your plan of action is in place in your first session, chances are after your second, third, or fourth, it will change a bit, because we would always work at the skin space. So that is scarring and my journey that I'm currently dealing with. I am sharing more updates on all the other platforms like Instagram and TikTok. Go and have a look, but let me know also also about your journey. I would really love to hear what you've gone through and how you've dealt with it. And are you seeing any results? Thank you so much for listening today. I'm excited to see you again soon.